Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. I'm joined by Mr. Adam Thacker this morning, who's Chief Operating Officer of Good Samaritan Hospital. He's going to start out by giving us an update on the state of COVID-19 preparation in our community.
Yeah, good morning. So a couple of exciting things to announce. So this morning we are opening up our Pediatric Respiratory Clinic. That's an area that we've been watching, and there have been a number of pediatric patients that have had respiratory symptoms, not all COVID. There are a lot of other respiratory symptoms going on, but we have opened up a pediatric clinic. It is out in Willow Plaza, a few doors down from our drive-through respiratory clinic that has been open for a number of weeks now. Dr. Heather Nichols, one of our pediatricians, will be staffing that along with her support staff. You can call the triage line, 812-885-3331, or if you contact your regular primary care provider and need a same-day visit for respiratory symptoms, they will help to route you out there. It's not a drive-through style. We'll set you up with an appointment time, and you'll come straight in and go straight to an exam room, so there's not a waiting room experience. But that is opening up today, and to help meet the needs of where we see our pediatric patients needing care. So just an update from a county perspective, we have 15 positive cases now in Knox County. You've probably heard through Dr. Stewart as the Knox County health official the updates on that if you've been keeping track. All 15 of those individuals are at home, recovering well, being followed by our local health official team, and having a lot of success in doing that through the tracers. A number of their family members and anybody that was in contact have already been contacted and may require quarantine, and if so, they're following those guidelines. So we feel like right now that's going very well. Get a lot of questions about the sharing of information, where an individual works, who they are, specifically where they live. Please understand from a privacy standpoint that we protect the healthcare being delivered to patients. Our local health officials do, as well as at the hospital. So in no way, shape, or form trying to keep information from the public, but out of respect for the patients that are under the care of healthcare providers, we don't share specifics.
And it's one of the important things that Adam was pointing out with regards to our community is with contacts. And we get a lot of questions with regards to, well, if I've been in contact with somebody who has been infected, or if I've been in contact with a family who is being isolated, what do I need to do personally? And the important thing to keep in mind is the contact has to be extended and it has to be fairly close. So when whole families are being isolated because of a positive member in the household, it's because they live in close proximity. So being out in the community with those people, or being at the grocery store with those people, or being around somebody who has been found to be positive does not in any way mean that you need to be isolated yourself or quarantined. We do ask that people, again, follow just what we've been doing for the last 4 weeks, which is good social distancing and good hand hygiene. There have been a lot of questions come up recently with regards to masks, and with what we've been doing over the policies over the last 3 or 4 weeks, that's adapted quite a bit. We had several questions last week with regards to just optionally wearing a regular cotton mask or a homemade mask out in public. And the important thing to realize is that those masks are to keep you from spreading your own germs, bacteria, viruses out into the public, but not necessarily the same as what the protective wear is that we do here at the hospital as far as protective gear. It's perfectly fine to wear those types of masks. They're not really harmful as far as we can tell. It's important to make sure that those get laundered appropriately, and so people who are wearing those around the hospital, or people who are part of our staff that are optionally wearing them, we're asking them to wear those and then launder them on a daily basis as well. And might come in a little bit, one of the things that's been very encouraging over the course of the past week is an increased volume of available protective equipment and some recycling measures that we're doing for those, and then also some testing supplies that have increased recently.
Yeah, so you've likely heard through the news that supplies has been front and center of a lot of the COVID response for healthcare providers. We have a number of PPE, so personal protective equipment, that go into taking care of any patient that is potentially infectious, not just COVID. Masks are certainly one of the key elements of that. We have a team that's working right now in putting new elastic bands on masks. The masks are perfectly functional, but they were older masks, so the bands weren't holding tight, and that form fitting is really important. So we have somewhere in the 8 to 10,000 masks that are being rebanded for use. And then we also rolled out last week a reprocessing plan, which allows the masks to be re-sterilized so that they're used. These are all the medical professional masks that meet what's called NIOSH criteria for being used in a healthcare setting. Now, for the cloth mask that you may wear in public, or you may see some of our employees wearing out in the offices and outside of direct patient care in the hospital setting, those can be laundered like your typical laundry to clean them, and that takes care of keeping them sanitary as long as the integrity of the mask stays intact as far as the wearing. On the testing supply front, we've been able to acquire more tests, which is positive because we are going to be relaxing some of our outpatient testing. So through our respiratory clinics, as you probably know, we've been very strict in our testing and following the State Department guidelines requiring hospitalization or somebody who's pretty sick. Moving forward, we're going to relax that a little bit, but this is not asymptomatic testing everybody. You're still going to get assessed by a provider. You still have to be symptomatic, fever, chills, some muscle pain, fatigue, cough, all of those symptoms that we've talked about. But individuals that are over the age of 60 are considered high risk for potentially being sicker, and also individuals that have some underlying comorbidities, which are diabetes or heart disease or lung disease, that are just at a higher risk to have potentially the need for hospitalization. We want to catch that as early as possible. But if it were up on the screen, I would underline, bold, and make it in big font that it would say symptomatic. So testing for patients that don't have any symptoms is unlikely to yield any result other than negative, because we're testing for a virus that has to be present. So you still have to be symptomatic, but you will be able to go through our drive-through clinic, get assessed by a provider, and we will be testing more as long as our supplies allow us to do so.
And one of the things that, as we roll out increased testing, is that we still say that the testing really doesn't change anything about what we do with the disease or how we manage the disease. One of the important updates that we got from our county health officer this morning, Dr. Stewart, was that the patients that we have in our community that have been positive are at home. They're being managed with their symptoms at home. They're not admitted to the hospital, and they're not requiring any other type of intensive treatment, but they're recovering on their own. And so while testing helps us from an epidemiological standpoint to find out in our community how many people are positive and what the spread is like, it still doesn't change anything really as far as what we do about the disease or how we manage it. As more of those tests get performed, ultimately we will see more positives in our community, but it just basically helps us to determine what the state is and how much spread has occurred locally. We've had a few questions also come through with regards to antibody testing, and at this point in time we know that that's coming up relatively soon.
Yeah.
And how we're going to be using that is going to change over the course of the next few months or so. We know that more rapid antibody testing will be available, and we know that that's going to tell us who's potentially been exposed and who's had the disease and who's recovered from the disease, and potentially those patients can be helpful to our upcoming patients with donation of plasma and things like that.
Right.
So we are asking people, if it turns out that you have been positive, that we're going to set up a process to track those patients, and the health department will help us to figure that out as well. And those tests will come up over the next few weeks also.
Yeah, and the antibody test is one test that's being looked at from a scientific standpoint as what can help us in making those decisions around relaxing social distancing and shelter in place. Relaxing shelter in place. Social distancing probably going to stay in place even longer, but that's an important test in being able to say, do we have enough of the community that has had coronavirus, has recovered, has the antibodies, and now can start to go back to some sense of normalcy. Right now there is one antibody test that is actually FDA approved. You may see all kinds of news feeds out there about antibody tests, but there is actually only one that is FDA approved for medical use. As that grows, that's certainly something that we'll be offering down the road.
You had brought up the subject of relaxing those guidelines as far as shelter in place, and a lot of people have asked, well, I've seen on the national news and the federal government talking about relaxing those things. And I think it's important for our patients and our community to understand that not only are we managing to push off when our peak is going to be, but what that's going to carry with it, obviously, is that that's going to push off when our relaxing of the shelter in place will be early also. So one of the things that we have to compliment everybody on is the fact that doing what we've done, the measures we've taken over the course of the past several weeks, have really done a lot to help us with the capacity issues that we had a few weeks ago. So you want to take a minute to comment on where we were a week or two ago and what the most recent reports have been.
Yeah, good news. The first week of April, some of the forecasting data for the state of Indiana was that there were not enough ICU beds, not enough ventilators, that very difficult, tough decisions were going to have to be made in caring for individuals. Week 2 of April, all of that data gets put back into the model and reforecasted, and based off of social distancing, shelter in place, you as the community that really are the front line in addressing how big of a surge we see, we've had success. So week 2 modeling showed that we will be able to meet the need of our state. Now obviously there are certainly hot spots within the state that are struggling more than others, and those that are more densely populated, as we've talked about many times, are affected to a different degree. But really positive news that we saw across Indiana. Our ventilator capacity, our ICU bed capacity is able to meet the needs so long as everybody stays diligent with social distancing, shelter in place. This is not a let's go slap high fives with your neighbor and that we can relax everything. This is what we're doing is working, so keep it up part of the discussion.
And certainly those restrictions won't be kept in place any longer than we absolutely have to. We want to get back to normalcy just like everybody else does. But it's important to realize that all the measures that you all have taken over the course of the past several weeks have really paid dividends now. And talking about the flattening of the curve and spreading everything out and reducing that sudden influx of patients has worked. And so what has happened in our facility over the course of the past several weeks, in my mind, has truly been amazing to take the number of beds that we had and basically almost tripled those, and ICU capacity, and turning our negative pressure rooms. I'm not sure how many of those we have now, but it seems like nearly the entire floor that we had has been switched to negative pressure, and even expanding from there. So
yeah, our second floor, which is our ICU, those patient rooms are negative pressure. Our third floor, which is a general medical floor, those patient rooms are negative pressure, which allows us to provide care to potentially COVID positive patients or suspected COVID patients, keep our staff safe, as well as provide the best care possible. That's 60 rooms between those 2 units. Prior to any COVID response, there was a handful of about 8 rooms that were negative pressure. So a great work by our engineering team, facilities, and making that happen. Won't get into all the details of what positive pressure, negative pressure are, but it's a pretty big undertaking for what has occurred. And then there's a number of other rooms throughout the organization for surgery, for emergency department, labor and delivery for expecting mothers that may be COVID positive, to be able to provide the best care that we can.
Tiffany, did you have some questions online?
There are a couple. One of them is regarding masks. Which is more effective, the N95 or N100?
Well, it's a matter of percentages, and so it's all filtration, and so the particle size matters, and then how much of those particles get filtered out. So 100 is better than 95, I think, in all math and accounting and everything else. The same thing is true of the masks. But again, what we have to keep in mind is that exposure is about what's out around us in the environment. And so when you see those pictures of people coughing and this giant cloud of particulate matter that comes out from their face, basically the masks help to keep that in, and then if you happen to be around that person, that's helping to filter out those viral particles as well. So the higher percentage of filtration with the mask, the more particles get filtered out. Now, nothing is perfect, and so that's why, as Adam was saying, it's still very important that we continue with social distancing, good hand hygiene, everything else, is because regardless of whether you're wearing a mask, you want to keep yourself in an environment that has as lower percentage of those viral particles as you can. And that's why things have worked as well as they have so far, as people have done very well with that and dispersed themselves and have been keeping that spread as limited as we can.
And the N95 mask is the gold standard for medical professionals. As a community member, you do not need to wear an N95 mask. And keep in mind that if you have symptoms and you have to go out, if you just have a cough, or if you want to wear a mask out in the community, a cloth mask keeps from your droplets being expelled out into the community. the N95 mask is protecting somebody that's in a healthcare setting where there may be droplets due to procedures that are occurring and that type of thing. So a cloth mask meets the needs of the community.
Okay. Now, is a history of pneumonia considered an underlying lung disease?
Frequently, it would be considered an underlying risk factor. Now, people get pneumonia for a variety of reasons. Perfectly healthy people can get pneumonia. But typically, what we talk about is, as Mr. Thacker was discussing, diabetes, chronic lung disease, immunosuppressed states, those types of things are all risk factors for getting the disease, as well as age. I've had a number of people that have asked me, well, I'm 85, does that mean I'm going to get it? And the answer is no, not necessarily at all. What we see, though, is as you age, you typically have more medical problems, and as you have more medical problems, it puts you at a higher risk for a variety of reasons. Having had pneumonia in the past puts you at a higher risk, but not as high risk as somebody, let's say, who has chronic lung disease, emphysema, COPD, things like that. So it's important to realize that age itself is not going to guarantee that you're going to get the disease, or having chronic lung disease is not going to guarantee you that you get the disease, but it just puts you at a higher risk for those things. So those are the patients that we want to be sure that contact us early in the course of their disease if they're feeling ill. As Adam had said, we've kind of loosened up what the restrictions are on who we will test. And so in that population that's over age 60, if they become symptomatic, we want to see those patients, we want to clinically evaluate them, and then test them if it seems appropriate.
And is there any idea when Knox County and or Indiana will reach peak?
Yeah, so those are two different peaks. For the Indiana data, you may have heard Governor Holcomb last week mention the next couple of weeks as a really important time, and looking at the peak for central Indiana and some of those higher populated areas that we're entering this week and next week. For Knox County, we have specific modeling data that we plug in and look at, and we expect that our peak is pushed back a little bit further into May. That's a moving target, so first, second, third week of May, and we readjust every week based off of the number of positive cases we're seeing in the community and how many positive cases there are. So it's called the doubling factor, and I won't get into all of the science with it, but that's how we look at where the peak of the curve is going to be. And for Knox County right now today, it looks like that's going to be sometime mid-May. That certainly could change depending on what we see over the next day by day, actually.
Now, what about what was said on the news that flattening the curve just extends the curve over time? That everyone is eventually going to get exposed. They just didn't want to overwhelm the medical system all at the same time.
So there's a lot of explanation, as Adam was saying, as to what that means. When we talk about flattening the curve, it was basically, the goal of that was to try to decrease the sudden influx of patients that were overwhelming people. Unfortunately, when we look at other countries and the healthcare systems being completely flooded by patients, it was because they simply didn't have the capacity for that, and they didn't have the capacity to ventilate the people that they needed to ventilate, or have them in critical care available spaces in hospitals. And so one of the main goals of flattening the curve and social distancing was to spread that out over a long enough period of time that we would have adequate resources to take care of those patients. As we have seen in the national news in places like New York and New Orleans and Seattle and large communities where it's very difficult to social distance, those places were absolutely inundated by patients over a very short period of time. Now, that total number of patients may have been the same had it been spread out over a longer period of time, but quite frankly, all the measures that have been taken have helped us tremendously and given us time over the past few weeks to prepare our hospital. And then the other big benefit, as we've talked about in the past, is we've learned a lot just in the course of the past couple weeks as far as what treatments are available, what things are being experimented with, and what studies are being performed. And so all of those things have helped us to better take care of those patients. Now, whether everybody will come down with this, whether everybody will acquire immunity to it, we really don't know yet. We know that over the course of the next several months, with antibody testing and things like that, we will be able to go back and check patients who said, you know, I had this illness and I had a fever and I didn't feel very good, but I listened to you and I stayed home, and I'm curious as to whether I have immunity or not. And those antibody tests will be the first tool that we will use to say, yes, patient A, B, and C, you have had the disease, you've had the illness, you've recovered from it, you have antibodies from it, and you have immunity. And then the next step, of course, is going to be when we talk about a vaccine and when that will be available and who we will use that vaccine on. So obviously the patients who have had the illness and have acquired the immunity to it will not need to be vaccinated. And we know that the vaccine companies are working diligently on that, and we're looking at probably 8 months to a year until that's available. And so in the meantime, what we will learn over the course of the several months with the antibody testing will tell us what percentage of our population was affected.
Okay, this question, not exactly sure what this is, but I'm going to try it. Is MOG ab disease? I don't know. Do you know what that is?
Yeah, me.
I don't know.
MOGAB, MOG ab disease, still considered as high risk for a child if they were to get coronavirus.
Yeah, sorry, we'll have to look that one up for next time. I'll get back
So
with you
for a
on
child, we can ask one of our pediatricians to maybe comment on that later.
Okay, and then another one. Will the local physicians prescribe hydroxychloroquine, Z-Pak, and zinc?
Great
Sure.
question.
That is certainly one of the prevailing treatments that we're hearing as clinical trials are going on. The FDA did approve emergency use. Right now, that is still restricted to inpatient, hospitalized patients, and potentially upon discharge. So that severity of illness that would require that treatment. Keep in mind, 80%, 85% of patients, this is a virus, you're going to go home, rest, give fluids, and recover, and don't need to take medication. So with any medication, it's not going to be prescribed unless it's absolutely necessary, because as we've talked about, those aren't benign agents, and you shouldn't be taking medication if you don't have to. At some point, will there be outpatient prescribing of those medications? That's possible, but until we have good clinical data, your physicians like a Dr. Stine aren't going to prescribe that until it's well known that it's safe, effective, and that the benefit outweighs the risk of giving medication.
And it's important to realize too that at this point we don't know when it's appropriate to use those medications anyway. As Adam alluded to, these are medications that have tremendous side effects to them, one being cardiac death as a result of arrhythmias. And so there are medications that we use when we absolutely have to, and over the course of the next several weeks as some of the studies come out, we'll understand a little bit more about whether or not those medications should be used on the front end when patients are first becoming ill, if they should be used once patients are hospitalized with more severe illness, if they should be used in the outpatient setting. But right now, we don't want to be jumping onto that and using medications that potentially are dangerous and causing more harm than good at this point.
So, are you seeing coronavirus patients going septic?
So the process of how people become ill with this is transmitted through respiratory droplets as with the common cold and influenza and so forth. And so the majority of patients will get respiratory symptoms first and then systemic symptoms. And those systemic symptoms being fever and muscle aches and the things that Adam alluded to are very common and cross over with influenza, but can also cross over with sepsis. It's important to realize, though, that the major way that this affects the human body is through the respiratory tract. And you've heard us say in the weeks past that one of the first symptoms that we really worry about of progression of the disease is people becoming increasingly short of breath and feeling like they can't do their normal activities. And we believe that is when the lower respiratory tract becomes infected and there's fluid accumulation there, and you're not able to transfer oxygen across your membranes as well, and that causes you to be more short of breath. So as far as spreading into the bloodstream like a bacterial infection, causing sepsis in that manner, that's not necessarily the manner in which this disease process is more grave to the human existence. It's really more through the respiratory tract and lower respiratory symptoms.
Okay, like the flu, is this considered a seasonal virus? Will it go away once it gets warmer?
So the early projections are no, that the temperature change will not eliminate, certainly, coronavirus. I think it's too early to tell if this will have its own season or what exactly that will look like, but there are states in the South, Louisiana and Florida certainly, that weather has already warmed up and it did not have an impact on reducing transmission just by the virtue of weather. Now, one good thing about the weather warming up is that one of the best disinfectants will be out more, which is the sun and UV light, and help to keep the virus from living on surfaces outside. But we're still going to have to maintain good disinfecting principles within our home, still going to have to maintain the social distancing because it can be transmitted. So weather alone is not a factor. I think it will help physicians to rule out some of the other common illnesses that are respiratory and can be confused with COVID.
We obviously every year we see seasonal flu, we see seasonal RSV for kids, and we're past the point where those are already on the decline to the point where now they're sometimes even recommending in places that you don't need to do flu testing
Right.
now, don't need to do RSV testing, and that's because we've already passed through that seasonal variation. But we're really not going to know the course of this until we get a few months along and see what the decline is, and then obviously see what our immunity is in our community.
Yeah, if someone was very sick from October to December, could they have had this and not known?
You know, that it's all speculation at this point in time, and we know the incidence within the communities and within our country was very low up until we got into January and February. It's entirely possible that they had influenza. It's entirely possible that they had adenovirus or rhinovirus or human metapneumovirus, which we've seen a lot this year. But all of those things can produce very, very similar symptoms, and so as a result, we won't really know that. However, when the antibody testing becomes more available, we'll see after the fact if they say, hey, I'm pretty sure that I had it back in December and they had positive antibody testing, it's a possibility.
Does white vinegar work killing the virus on surfaces?
Not seeing any evidence to support that.
Are local medical staff taking hydroxychloroquine preventatively?
No, not as members of Good Samaritan. They are not. That's something we stay in close contact with all of our medical team, and that's not something, per the guidelines that we kind of spoke about, it's not recommended, and we're not going down that road at this time, and unless there becomes data that would suggest that would be important.
Do you have any idea how one with adrenal insufficiency would be affected in their ability to recover if infected?
So adrenal insufficiency limits your response to catastrophic events to your body. And so typically, if somebody becomes infected with any type of illness and has that medical condition, we support them with steroids and we support them with a variety of things. Obviously, that then has its implications with regards to a person's immunity as well. So in terms of how that illness versus a chronic respiratory illness would play into this, chronic respiratory illness still is going to be one of the major factors in terms of how you will be affected by COVID-19. So that wouldn't worry me nearly as much as another immunosuppressed state or chronic lung disease or diabetes.
If someone's already on PlaqueWhannell by a rheumatologist, would that help deter the virus?
We really don't know because the dosage is very different for that. And so many patients, their initial treatment for rheumatologic problems and autoimmune diseases might be PlaqueWhannell, which is hydroxychloroquine. But the dosages of that for suppressing the body's own immune response to your own tissues is different than what a treatment variety would be. We use chloroquine and hydroxychloroquine to prevent malaria and treat a whole variety of illnesses. And as Adam alluded to earlier, these medications are not without their problems. They have a lot of side effects to them, specifically neurological and cardiovascular side effects. And so usually when treating those illnesses like rheumatologic problems, we try to use the smallest dose possible. The primary reason for that is we want to try to avoid those side effects as best we can. And so as a result of that, it might have some preventative effects, but right now, since there's really not any data to support that, we don't know how much benefit there would be in previously taking those medications versus taking a treatment-based dosage.
And the pharmacist in me coming out, take the medication as prescribed by your physician. So that's prescribed to you as safe and effective treatment. Looking up online what the coronavirus treatment is and changing your dosing could be very unsafe. So if you're already on that drug for any rheumatoid or lupus treatment, take it as prescribed. Don't change your dosing.
What about taking aquarium chemicals? How do you feel about that?
Stay away from that as well. So in the news, the chloroquine products are in aquarium products, and those are certainly not approved for medical use and very unfortunate. But there was a couple outside of Indiana in another part of the country that did take those products in an attempt to self-treat, and it yielded catastrophic results. There was actually a death, and the other individual ended up in the ICU. So don't take any medications without consulting your physician.
To be conscious of time, there's several more questions. Do you want to keep going, or do you want to go ahead and respond to those on your own later?
You can give us a couple more if you'd
Sure.
like, and then
Okay.
I'll go online later and address the other ones.
Okay. What about people with sarcoidosis who have most of these issues most days? How would we know the difference between this and a flare-up?
So typically with sarcoid, there's not going to be fever symptoms. One of the things that is a hallmark of this illness, as with many viral illnesses, is going to be fever. We monitor our staff on a daily basis, and we monitor our patients on an hourly basis to see how their temperatures are going. But patients with sarcoid typically don't have fever. Now, certainly they have muscle aches and they can have respiratory symptoms and things like that, but usually they wouldn't have fever associated with it.
Okay, understanding HIPAA laws, and of course the hospital not sharing identity of positive cases. Is GSH or authorities encouraging or forcing those who are positive to not let the public know?
No. We can't control the information communicated by a patient. I know in other communities there have been positive patients that have taken to Facebook or have taken to other forums to say I'm positive with COVID, just letting folks know. We don't control that message as health officials for Knox County, and certainly as Good Samaritan, we respect the privacy of each individual. But if they choose to communicate in any type of forum as to their own health care, no different than COVID or not, somebody can post they have diabetes, newly diagnosed. They can also post or put out some communication that they are positive with COVID. That's patient discretion.
And we found a lot of patients who have been screened initially, who've seen our respiratory clinic or been to their primary care doctors, who have been told, hey, we would be suspicious that you potentially would have this illness, are then going home and interpreting that, well, I have COVID-19, they think I have COVID-19, and then they're dispersing that information to say that they're positive. Really, we have a very limited number of positives. I think 130 or 140 tests have been done thus far. We've had a total of just 9 that we have tested that have been positive so far, and 15 within Knox County. So it's an extremely limited number of patients at this point in time. Now, that's not to say that within those groups of positive patients, there are a number of family members that have been isolated and quarantined as a result of that. Those people may or may not be positive at this point in time. They're being tracked closely by Dr. Stewart and the health department. But just because somebody says, hey, I was a suspected patient or I was isolated, by no means does that mean that they were positive.
A couple of quick ones. Is a symptom of cough a dry cough or productive cough, or either?
The majority of patients that we have seen and have read about in the studies initially starts out as a relatively dry cough. So as opposed to a bacterial pneumonia or fluid in the lungs, initially it's very dry, it's persistent, and it goes on for a long period of time. We have stories of patients who describe being sick for a week or so and thinking they're getting better, and then start to develop advancing symptoms after that of shortness of breath. This has not shown to be as productive a cough as what we typically see with most types of bacterial pneumonia, though.
And last question, what vitamin supplements would you recommend to build up the body's immunity?
That's a great question, and I don't think we have a good answer to that. Basically, the things that I'm telling patients are, there's nothing specific that we can say, take zinc or take calcium or take vitamin C. But one of the most important things is to just do healthy things. So get rest, get adequate rest, get 8 hours a night, make sure that you're drinking adequate fluids, get out, exercise, eat healthy. All of those things encourage a healthy immune system rather than just one specific supplement. I tell all of my patients that rather than piecing together all different types of supplements and vitamins, if you want to take something, take a simple multivitamin once a day and eat a healthy diet. Here in the United States, we have an excellent food supply. Our farmers produce all the things that we need, and it's readily available. So as opposed to other places where they have limited nutrients in their diet, we have plenty of that. And so basically the things that we can help with are exercising, drinking plenty of fluids, and just getting plenty of rest.
Okay, that's all we have.
All right. I'll get online later and address the rest of your questions as they come through, and we'll try to get specifics from you and address that as needed. Thank you all very much for joining us today.
Thank you. Good job.